We have a failing health care. I shouldn't say this to our great gentleman and my friend from Australia, because you have better health care than we do.
Bullshit.
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 Bullshit. Bullshit. Bullshit.
This is not like furniture, which sometimes you allude to, Ben. You could have good furniture, bad furniture. I've had it all, right? That's optional. If you don't have good health care, you die. And so I view it as not something that capitalism should deal with, and I believe in capitalism, and I think they make great sneakers, but something that is about equality of opportunity. And you cannot have equality of opportunity if you're dead. So Medicare for all.
Okay. Go ahead. So a couple of notes in response to the Medicare for all shtick. So this is Bernie Sanders shtick, obviously. The problem with Medicare for all is that when people say that it's affordable, this is affordable to the person who has the Medicare. It is not affordable to the country. In fact, it is so unaffordable to the country that the state of California was a nut job leftist state, just refused to even pass Medicare for all because it would have immediately doubled the debt. The truth about healthcare is this. There are three qualities of healthcare that you can have. You can have affordability, you can have universality, or you can have quality. And you can have two of those three things, but not all three. Right? You can have universality, affordability, or quality. Two of those three things you can have. And one of the things that's happened with Obamacare is that you've gotten closer to universality, but you haven't gotten any closer to either affordability or quality. And the Republican Party seems to be falling into the trap of basically just copying what the Democrats do, except being worse at it. What they actually need to do is relieve the regulatory burden that is driving up the cost of health care, and they need to stop acting as though insurance companies' jobs is actually just to reimburse people for their bad health. If you join up with an insurance company and your health sucks to begin with, you're going to pay more because it's an insurance company, not a charity. And that doesn't mean that we can't have... Now, that doesn't mean that we can't have some form of backup for people who have pre-existing conditions. I would hope that the social fabric would help fill that in. This is why I'm a big believer in charity and churches and synagogues filling that gap. But what we can't do is suggest, as the Bernie Sanders left does, that health care is an inalienable right, and therefore you can put a gun to my wife's head, she's a doctor, and you can force her to provide care at any cost you want to pay. You can't do that and hope to increase the supply of health care. Health insurance is not health care. They're not the same thing. And anybody who tells you differently is lying or trying to sell you something.
Excellent. So there is a much better balance to be had. And if you said to me, well, you're going to have $800 in taxes that are new, I say, wow, that hurts. But you're going to save $1,000 in premiums, deal. That is a deal I will take every time because I can do math.
Okay.
So that is the beginning of your answer to taxes, and then you said how much care. Well, so that is something that all the countries that do single payer or a version of single payer struggle with, and they have learned a lot of lessons. And if we stop saying, America's #1, we might actually just, first of all, on this issue, we're number 37. And if we looked at what Japan is doing so well, keeping costs down to half of ours and less, we might actually learn something from Japan, Switzerland, and other countries.
And Australia.
G'day, Paul.
G'day, love.
And by the way, when we say Medicare for all, Medicare Advantage exists. So you can actually add private insurance on top of that, and I find that perfectly great. I have no problems with that at all. So that is the government making sure you don't die and actually lowering rates for you. And then if you want more insurance, no problem.
So all this sounds great, except for the fact that Medicare, Medicaid, and Social Security eat up 66% of the federal budget every single year. The idea that all of these socialized medicine countries have it so much better than we do, particularly in terms of cancer care, is a joke. We are still #1 in terms of 5-year cancer survival rate here in the United States. You elided this question by saying we can learn stuff from Japan. The standard of care is the entire question when it comes to single-payer health care. That is the entire thing. If people felt like they were going to get the same access to care in a single-payer health care system as they did in a system where they can pay their own way, then we would have no controversy here. But the fact is that rationing is mandated as soon as you start having the government run the healthcare system and decide what level of care people get. So I don't want anyone deciding what level of care that I can get. I don't want anyone else to, they don't care about me. They don't know my child's name. They don't know my name. All they know is how much I cost.
It's going to be fantastic health care. Right now, Obamacare is failing. We have a failing health care. I shouldn't say this to our great gentleman and my friend from Australia, because you have better health care than we do. But we're going to have great health care very soon.
The president said that he thinks Australia has better health care. What's obviously interesting is Australia happens to have nationalized health care. Also, we just talked to Senator Bernie Sanders, and Senator Sanders commented about what the president said. Let's play that.
Well, Mr. President, you're right. In Australia and every other major country on earth, they guarantee health care to all people. They don't throw 24 million people off of health insurance. So maybe when we get to the Senate, we should start off with looking at the Australian healthcare system or the Canadian healthcare system, which guarantees healthcare to all people at a much lower cost per capita than we do.
So let us take a moment to look at the main differences between public and private healthcare in Australia. Public healthcare, which includes Medicare, is provided to all Australians and permanent residents. The public system provides affordable, accessible and high-quality healthcare by providing cover for medical services, such as doctors and specialists consultations, admission to public hospitals, and also subsidises some drugs under the Pharmaceutical Benefits Scheme. If you go to a public hospital as a public patient, you'll be treated free of charge by a doctor appointed by the hospital. However, depending on the treatment you need, you may have to join a waiting list. If you want to avoid public hospital waiting lists, choose your own doctor, be treated at a private hospital, or be covered for additional types of out-of-hospital treatment, you can either pay for this yourself or take out private health insurance. So why do people choose private health insurance? Private health insurance gives you more choices when it comes to your hospital treatment. To start off with, you can choose from a wider range of hospitals. You can choose the doctor you want. You can usually choose when you go to hospital for your procedure. And you can get cover for out-of-hospital extras, such as ambulance, dental care, optical, physiotherapy, and other services not covered in the public system. While private health insurance gives you more options for your health care, it also means there may be some extra costs you need to pay yourself. Unlike the public system, you may be charged a gap fee for your doctor's services. If you're scheduled for an admission to hospital, always ask your doctor for more information about their fees. If you're being treated for a condition which isn't fully covered on your policy, you may also have to pay for some or all of your hospital theatre and accommodation fees. If you're planning a hospital admission, always ask your health fund and the hospital about any potential expenses you may have to pay. Finally, if you need to use your hospital cover, your policy may have an excess or co-payment. An excess or co-payment is an amount you agree to pay towards the cost of hospital treatment in exchange for lower premiums. So in a nutshell, private health insurance gives you more choices with your healthcare and can help pay for the things that the public system doesn't.
Apart from that, no worries. You'll have the time of your life in Australia. Of course, we talk the same language. Although you lot do have a funny accent. Come on, come and say g'day. I'll slip an extra shrimp on the barbie for you. Come and say
g'day. Austria! Well then, g'day, mate. Let's put another shrimp on the barbie.